In this video, I'm going to discuss cervical spondylosis. What is it, and what are some treatment things that you can do at home? Spondylosis of the cervical spine is, generally speaking, kind of that arthritic change where the joints start to have that bony overgrowth. Maybe the disc is decreasing a little bit in size. Just everything is kind of compressing down a little bit. Just general wear in the area. Some of the symptoms that you may experience may be neck pain and stiffness, as well as radiating pain or symptoms down in your arms and hands. So I'm going to show you some techniques that you can do to work on range of motion, as well as building some strength in that area. The first thing I want to work on is just general range of motion. So what you're going to do is turn and look over your left shoulder and your right shoulder as far as you can, completing that for 2 to 3 sets of 10 to 15 repetitions several times a day. You're also going to go into cervical flexion and extension as far as you can, 2 to 3 sets, 10 to 15 repetitions several times a day. And lastly, we're going to work on side bending. This one's difficult for a lot of people, and that's just bending the head towards the shoulder each direction, 2 to 3 sets, 10 to 15 repetitions several times a day. Now we're going to add a pillowcase into your range of motion that you're performing. This is going to add a little bit of an extra stretch and kind of a mobilization while we go through that movement. So what you're going to do is you're going to take that pillowcase, you're going to put it behind the neck, so you're kind of hooking that under the base of the skull here. And I'm going to work on rotation first. I'm going to look over my left shoulder. As I look over my left shoulder, I'm pulling kind of up through my eye and across with the pillowcase. I'm pulling up, I'm turning my head, and then I'm also pulling with the pillowcase. You're going to feel that pressure on the back of the neck there. Don't pull so hard that it causes discomfort from pulling on the pillowcase, but you want enough of a pull that it really just, you can feel that increased tension. And you're going to go the opposite direction, the same way, kind of pulling up through my eye and across, assisting that movement. Then you can do this also with cervical extension. So I'm going to work on just looking up. So I'm pulling up through my eyes the whole time. I'm sustaining that pull the whole time that I'm moving. That's the trick with this. You want to make sure that the entire time that you're going through the movement that you're keeping that force of that pull. You don't have to pull super hard, but just a little bit of a pull. I'd complete that for 2 to 3 sets of 10 repetitions several times a day. Now we need to add in some strengthening exercises. We're going to start with isometrics. Now isometrics are where there's a muscle contraction, but there's no joint movement. So what you're going to do is you're going to take your hand, put it on the side of your head. Doesn't matter which side you start on, first. And I'm pushing my head into my hand. How much force am I exerting? Just a little bit, not a whole lot. A little bit of, I can feel these muscles firing over here on the side of my neck. I'm going to hold that. I'm going to hold that for about 5 to 10 seconds, and then I'm going to relax. And I'm going to repeat that for 2 to 3 sets of about 10 repetitions. And then I'm going to go to the opposite side the same way. Now I'm going to go to the left. Do the same thing, hold it the same amount of time. Then we're going to work on extension, hand behind the head. And I'm trying to look up at the ceiling, and I'm pushing my hand into the back of my head, not allowing that movement to occur. And then you're going to work on forward flexion, hand on the forehead. I'm trying to look down. I'm resisting that movement. Sometimes people will use both hands and push down. I'm resisting that movement. You're going to hold that and go through several sets, 2 to 3 sets, several times a day. Next, you're going to perform resisted band exercises. So you're going to take this band, put it behind the head here. As far as what band do you use, there's all kinds that you can use. I'll put a link in the description for some that you can purchase. And I'm going to try to look up. As I look up, I'm pulling against the band, just pushing the back of my head into the band as I look up. I complete that for 2 to 3 sets of 10 to 15 repetitions. Then we're going to work on side bending. So I'm going to take the same band here, put it on the side here. I'm going to hold it. I'm trying to bring my left ear to my left shoulder. I'm going to push against it there. I'm going to go that direction the same way. 2 to 3 sets, 10 to 15 repetitions. Then I'm going to put it on the opposite side and bend to the right. And then lastly, we're going to go into forward cervical flexion. I'm going to put it across my forehead here. I'm trying to look down at the floor. I'm pulling back on the band. Now with this, you don't have to get a really, really strong band initially. You can work up to that. You don't want to overstrain the neck, cause additional spasms and all to happen. And if while you're doing these exercises, you have an increased occurrence of symptoms radiating down your arms or hands, you may need to back off of that a little bit. Maybe not do as many sets or repetitions or as frequent throughout the day. Just kind of have to play with that and see what works best for you, because we definitely don't want to irritate and aggravate symptoms any more than we have to. It's normal when you first start doing some of these movements and exercises to aggravate that area, but as long as it calms down. We don't want it to go up so much that for several days afterwards you're not able to perform these exercise movements again, or you're not able to perform your daily tasks and activities because you've stirred up so much pain and muscle spasms, etc. Now I want to work on a few scapular strengthening exercises, and I like to do this in combination with the cervical spine. So the first thing we're going to do here is you're going to take your band, elbows by my side here. I'm going to work on pulling the band apart, similar to a rotator cuff exercise for that rotation in the shoulder. So I'm going to pull that apart. As I pull that band apart, I'm squeezing my shoulder blades together in my back. So I'm pulling band apart, squeeze my shoulder blades together and relax. And again, band apart, squeeze my shoulder blades together and relax. Complete 2 to 3 sets of 10 to 15 repetitions with that exercise. Now we're going to do what I call band pull apart. So you're going to put the band out in front. You're going to pull this apart, squeeze your shoulder blades together, and while you're doing that and you pull this apart, squeeze your shoulder blades together, I want you to retract your cervical spine. So pull your head straight back. Okay? So you're going to pull this apart, and while you're pulling it apart, go straight back with your cervical spine. You're going to hold that. You're going to feel that all the way from your neck down to your middle back. I usually have my patients hold that for maybe 2 to 3 seconds and then relax and then come back, 2 to 3 seconds and relax, and complete 2 to 3 sets of 10 to 15 repetitions. Next, we're going to perform shoulder shrugs using light dumbbells. Initially, start with a dumbbell that's light enough that you can control the weight and this doesn't overstrain your neck or your shoulders. And so what you're going to do is just keep your arms down by your side. You're holding onto the dumbbells, and I'm going to shrug my shoulders up as high as I can and then come right back down. So I'm shrugging my shoulders up, kind of squeeze that at the top, feel that across the top of my shoulders and my neck, and back down. And repeat that for 2 to 3 sets of 10 to 15 repetitions. Next, we're going to use a tennis ball for a little bit of tension release or muscle release, or just really whatever you want to call it. I call it that. It hurts so good in the area, kind of calm down the pain a little bit and the tension you're having. So you're going to take the tennis ball, put it in a pillowcase. I like to use a pillowcase because that way, if you drop the tennis ball, it doesn't hit the floor, it's in the pillowcase, and you're holding on to it. Put this over my shoulder so it goes back here wherever you're having pain, between the shoulder blades and the upper trap area, wherever that is, and you're just going to lean into it. So I'm just holding pressure, leaning against the tennis ball, and I may hold that for 30 seconds. I may stay in this position for a minute, just whatever feels best to you. You can actually lie on this on the floor, on the bed if you want to, if you don't want to stand while you go through it. Just a really simple technique to try to relax some of the muscles in the area. The last thing that I recommend to my patients, if their skin's able to tolerate it and they're okay to use a heating pad, is using heating pads or moist hot packs. Put that around the shoulder area. You can wrap that around the neck. Just kind of wherever you need that heat to relax the muscles and kind of give you some pain relief, especially to allow you to be able to perform the range of motion and strengthening exercises, which are really the things that we need to be doing. Thank you so much for watching. I hope this video helps with your neck pain and any radiating symptoms you may be having from your cervical spondylosis.